Vanakkam, good morning. In this video, we are going to discuss about the counter current mechanism. Counter current system consists of two closely arranged parallel tubes. The flow should be in the opposite direction. In the nephron, the loop of Kenley and vasa recta both are closely present parallel tubes, but the flow is in the opposite directions. So the loop of Kenley is act as the counter current multiplier. Vasa recta is act as the counter current exchanger. The vasa recta is the continuation of the efferent arteriole. It is connected to the renal vein. The loop of Kenley is continued with the distal convoluted tubule. The kidney counter current mechanism is important for the concentration and dilution of the urine. In the nephron, this is the loop of Kenley. The loop of Kenley act as a counter current multiplier or counter current generator. So it is important for the concentration of the urine, concentration and dilution of the urine. Counter current multiplier, counter current generator. The vasa recta is maintain this concentration of the urine. So the vasa recta is act as a counter current exchanger. So vasa recta is a counter current exchanger. Loop of Kenley is the counter current multiplier. The counter current mechanism, loop of Kenley act as the counter current multiplier. The vasa recta is act as the counter current exchanger. In the loop of Kenley, at the place of thick ascending limb of loop of Kenley having the sodium potassium chloride co-transporter that reabsorbs the sodium and chloride along with the potassium into the medullary interstitium. This increases the medullary osmotic gradient. So this is called as the single effect. When the filtrators flow through the lumen of the nephron at the first time, it causes the small effect on the medullary osmotic gradient by the sodium potassium chloride transport in the thick ascending limb of loop of Kenley and water reabsorption from the thin descending limb of loop of Kenley. This is called as the single effect. So during the single effect, it can increases the medullary osmotic gradient up to 200 milliosmol per liter. Factors alter the concentration of the urine or concentration gradient in the renal medullary interstitium. So juxtamedullary nephron is important for the concentration of the urine. So that is present in the renal medulla. So concentration gradients. So at the end of the proximal convoluted tubule, 300 milliosmol per liter. Gradually it increases towards the tip of the loop of Kenley, 300, 600, 900, 1200 up to 1400. When it reaches the distal convoluted tubule, again the concentration gradient is decreases 900, 600, 300. This concentration gradient increases towards the tip of the loop of Kenley is important for the concentration of urine. And the level of ADH. So ADH is important for the reabsorption of the urine in the distal convoluted tubule and collecting part. That is also play the very important role in the concentration of the urine. The loop of Kenley's act as the countercurrent multiplier. The ascending limb of loop of Kenley is impermeable to water. In the ascending limb of loop of Kenley contains a sodium potassium chloride co-transporter. It transports the sodium chloride into the medullary interstitium. This is called as the single effect. It is repeatedly occur when the filtrate reaches the ascending limb. The osmolarity in the ascending limb further decreases due to the reabsorption of the sodium chloride in the distal tubule. The medullary interstitial osmolarity is gradually increases due to the sodium potassium chloride pump increases the medullary interstitial osmolality. It favor for the water reabsorption from the descending limb of loop of Kenley. Descending limb of loop of Kenley is permeable to water and impermeable to sodium chloride. So when it moves towards the tip of the loop of Kenley, osmolarity is gradually increases. When it's moved towards the upwards towards the distal convoluted tubule, osmolarity is gradually decreases. Counter current exchanger. Counter current exchanger is important for the maintain the medullary osmolality gradient. The vasa recta is act as the counter current exchanger. It is originate from this is the vasa recta. It is originate from the efferent arteriole. It is parallel to the loop of Kenley, but in the flow occur in the opposite direction. Here the blood flow is very slow. In the descending limb of vasa recta, reabsorbs sodium and secrete the water. And ascending limb of vasa recta absorbs the water, eliminate the solutes. So it is important for the maintain the osmotic gradients. Role of antidiuretic hormone in countercurrent mechanism. Antidiuretic hormone act on the distal convoluted tubule and collecting duct. It increases the number of the aquaporin channels in the lumen of the tubular tubules. It increases the water reabsorption. It is important for the concentration of the urine and increases the medullary osmotic gradient. It is also facilitate the sodium potassium chloride reabsorption in the thick ascending limb of loop of Kenley. The ADH is also helpful for the urea reabsorption in the medullary collecting duct, inner part of the medullary collecting ducts. So it is important for the medullary osmotic gradient. The ADH vasopressin effects act on the vasa recta. It produces the vasoconstriction. So blood flow through vasa recta is very slow. It is important for the reabsorption of the solutes and maintain the osmotic gradient in the tip of the medulla. These are the actions of the ADH in countercurrent mechanisms. ADH not only maintain the osmotic gradient, it is also helpful for the concentration of the urine in the depend on the conditions. Antidiuretic urea is absorbed passively from the inner medullary collecting ducts into the medullary interstitium through urea transporters. Then into the ascending limb of loop of Kenley, when it reaches the collecting duct, it is absorbed again. This urea cycle, this cycle again and again, reabsorbed and enter into the thick ascending limb of loop of Kenley. So it is circulation. urea cycling contribute to the 40% of the medullary interstitial osmolarity. Mechanism of formation of the dilute urine. At the Bowman's capsule, filtrate osmolality is 300 milliosmol per liter. In the proximal convoluted tubule, active reabsorption of sodium chloride and obligatory reabsorption of the water. So at the end of the proximal convoluted tubule also, the osmolarity 300 milliosmol per liter. The descending limb only permeable to water. Water leaves by osmosis. It increases osmolarity from 300 to 1200 milliosmol at the tip of the loop of Henle. And the ascending limb of loop of Henle, active transport of the sodium chloride, osmolarity is decreases from 1200 to, at the end it is around 200 milliosmol liter. The distal convoluted tubule, absence of the ADH, the collecting duct impermeable to the water, pollutes reabsorb osmolarity further decreases from 200 milliosmol to 150 milliosmol. The intermedullary collecting duct urea reabsorbed osmolarity further decreases from 150 to 60. It forms the dilute urine. Mechanism of formation of the concentrated urine. At the Bowman's capsule, osmolarity is 300 milliosmol per liter. The proximal convoluted tubule, at the end of the proximal convoluted tubule, after the reabsorption of the sodium chloride water, 300 milliosmol. Descending limb, water is reabsorbed at the tip of the loop of only 1200 milliosmol per liter. The ascending limb, active reabsorption of the sodium chloride. The osmolarity is decreases 1200 to 600. At the end of the distal tubule, the osmolarity is 200 milliosmol per liter. The presence of the ADH permeability of the water. So the facultative reabsorption of the water increases the osmolarity from 600 to 1200. So it forms the concentrated urine, hyperosmolar urine. Thank you for watching this video. If you like this video, press the like button, share your friends. Those who are not subscribed to this channel, please subscribe. These videos briefly discuss the physiology topics. You must read the physiology textbooks. Thank you once again.